Good morning, everybody. It is my honor to speak here, and I'm very happy to share my topic with you. Mm, Today, I would like to talk about the impact of the global pandemic COVID-19 on society and health. So you can absolutely see several considerable number of in my introduction. This number it represents sweeping 230 countries, affecting more than 2 million people and 150,097 people deaths. So in the past century, there has been no incident like COVID-19 has had such a big impact on human life. This is devastating and serious public health risk with difficult and sometimes panic. Unfortunately, none of the drugs treatment has proven effective, and almost all drugs being tested and reused and used on a compassionate basis. Let us focus our attention on the middle part of my poster. It's argument size. For the first size of the argument is the impact on people's health, because people have not found an effective way to eradicate the virus, like the cure the virus. It also affects hospital, health system, and transportation. For the second side of the argument, the rational allocation of resource, government policy, and governance security measure has triggered people's arguments. Let us see the excellent research summary one. First, actively cooperate with public health department. At the same time, so that people can better understand the panic trend. Second, continuous and active strategic development and problem solving. Third, expand extensive care hospitalization so that all sick people can be effectively treated. Let us see the excellent research summary too. First, the utilization of the healthcare and medical service has dropped it significantly when the pandemic just started. People ignored their behavior. This is a very big problem because resources in the pandemic continue to worsen. Second, the medical system has an immediate and long-term finance impact. Third is economic loss, apparent damage to the health care institution due to the necessary lockdown. It has caused economic loss and absolutely harm the medical system. Fourth, hospital face challenge and lockdown due to the increase in number of patients, which has brought big pressure to the hospital. Let us see the blue parts on the left. COVID-19 has severely affected people's health and influenced many other things. We will better understand the impact on society during the pandemic and harm caused solutions through the investigation. For my opinion, strengths protection against the COVID-19, because as long as humans have not found effective way to control the spread of the virus, people cannot let go of their vigilant against the virus. Number two, help affect business through good policies. During the pandemic, many companies cannot work typically, and some company has even gone bankrupt. So therefore, the government should be concerned about the pandemic impact on business and or company while eliminating the virus. So number three, strive to improve the efficiency of the hospital. The government should improve the efficiency of a hospital through various uh, uh, very means, such as mobilizing personnel from private hospital or community hospital, increase the number of people in major hospital. So for the major hospital, is absolutely a lot of people get a lot of sick people in there. So this is why they help a major hospital achieve high efficiency through the active cooperation. So for number four, protect the impact of COVID-19 on the private sector to achieve the purpose of protection through the reasonable publicity of COVID-19. For example, put up the COVID-19 related poster in the place where people's behavior cannot be managed, like the mall, the big mall, the supermarket, something like that. It will remind people to disinfect. And number five, strength protection for doctor working during the pandemic. Demand for doctor to provide N95 mask and personal protective equipment like PPE. We must save mask and other protective equipment now to protect clinic in the future. So we must also be strategical in our plan to use the personal protective equipment and consider unique strategy to expand our supply, including prolonged wear and reuse nursing facility, abundant the use of personal protective equipment when working with effective patients. So why I believe this size protecting health worker is essential through increased production and a creative use of space, staff, and supplies can greatly expand healthcare, no matter how severe the impact of COVID-19. We will face the better effort next time to reduce the harm caused by society. Let people's lives return to normal. So let us finally look at the conclusion at the bottom of my poster and my suggestion. COVID-19 is the significant challenge people are currently facing, and I want to help people through my knowledge of COVID-19. It also allows 015 students to understand the social change during the pandemic, the impact and all aspects of society's future development, and let us know our health problem during the pandemic. So I will suggest the 050 student. First is protect yourself and make sure to protect against the virus. Number two, learn more about society during the pandemic. Number three, keep the positive attitude. Yeah, it's very important. Turn to the COVID-19. So I have finished my delivering my speech. Thank you for your support and your kind attention.